test, the creatinine clearance test, measures your body's ability to eliminate waste products through the kidneys. Creatinine is a waste product created by the breakdown of muscle tissue and protein in your diet. Healthy kidneys remove creatinine from the bloodstream while retaining essential elements like proteins. Tiny clusters of blood vessels within the kidneys called glomeruli perform this vital task. The glomerular filtration rate, or GFR for short, measures how efficiently your kidneys remove waste. High creatinine levels often indicate a decline in GFR, suggesting compromised kidney function. High blood pressure, diabetes, and obesity are well-known risk factors for kidney disease. Unfortunately, many people are unaware they have kidney disease until significant damage occurs. Early stages of chronic kidney disease, or CKD, often have no noticeable symptoms. That's why regular checkups and monitoring of creatinine levels are crucial for early detection and intervention. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Now, let's return to the topic of creatinine. One of the best interventions to lower creatinine is to adjust your diet. A study published in the Journal of Kidney Medicine found that consuming more fruits and vegetables might help improve kidney function. Researchers observed a decrease in the urine albumin to creatinine ratio, or UACR in short, in the group that ate more fruits and vegetables than those who didn't. UACR is a simple test that measures the amount of albumin, a protein found in your blood, compared to creatinine. A lower UACR suggests the kidneys may be working better. While this study focused on fruits and vegetables together, in this video, you'll learn about 9 fruits that lower creatinine levels and improve kidney health. We'll also discuss the symptoms that might indicate kidney disease and lifestyle approaches to keeping your creatinine levels in check. 9. Apples. Apples are rich in pectin, a soluble fiber that binds to harmful substances in your food and removes them from your body during digestion. This process reduces the burden on the kidneys and may indirectly contribute to lower creatinine levels. Apples also contain quercetin, an antioxidant with anti-inflammatory properties that may protect kidney cells from oxidative damage. Oxidative damage happens when there's an imbalance of antioxidants and unstable molecules called free radicals in your body. Your body naturally produces free radicals as it uses energy, and the antioxidants keep these molecules in check. Exposure to air pollution, cigarette smoke, and certain medications can create even more free radicals. Too many free radicals can overwhelm the antioxidants, leading to oxidative stress. This imbalance can contribute to the progression of kidney disease or kidney failure. Individuals with kidney disease generally tolerate apples. As part of a balanced diet, aim for 1 medium apple, around 200 mg potassium, daily. You can enjoy the fruit whole, sliced in salads, or blended into smoothies. Some precautions should be taken when eating apples. The high fiber content may cause some individuals to experience bloating or gas. Here are some tips for choosing the best apples. Look for firm, brightly colored varieties with smooth skin. Store them in your refrigerator's crisper drawer to preserve freshness. Remember to wash apples thoroughly before eating to remove any pesticides. 8. Cranberries. Cranberries are another fantastic fruit to add to your kidney-friendly diet. Cranberries are well known for their proanthocyanidins, a type of antioxidant with anti-adhesive properties. These compounds may help prevent harmful bacteria from sticking to the bladder wall, potentially reducing the risk of urinary tract infections, or UTIs. If left unchecked, UTIs can damage kidneys, so preventing them can indirectly benefit kidney health. Cranberries are also a good source of vitamin C. Vitamin C acts as an antioxidant by neutralizing free radicals that can damage kidney cells and tissues. However, be mindful of some precautions. Cranberries have a moderate potassium content of around 80 mg per cup. If you have advanced kidney disease or are on potassium restriction, consult your doctor about suitable serving sizes. Studies show that cranberries may have food-drug interactions, which can reduce the effectiveness of medications like proton pump inhibitors and histamine type 2 or H2 blockers. These are used for stomach acid reduction. Cranberries can also interact with blood thinners, increasing your bleeding risk. High doses of cranberry supplements or juice may cause minor side effects such as diarrhea, abdominal discomfort, and nausea. If you're taking any medications, discuss cranberry consumption with your doctor to ensure it won't interfere with your medications or cause any side effects. Consult your doctor for personalized recommendations on incorporating cranberries into your diet safely and effectively. Cranberries can be bought fresh, frozen, dried, or juiced. When shopping for fresh cranberries, look for firm, bright red cranberries. 7. Berries. Blueberries, strawberries, raspberries. Berries are a rich source of antioxidants called anthocyanins. Like most antioxidants, anthocyanins help combat free radicals throughout the body, including those in the kidneys. Blueberries and strawberries are also packed with vitamin E. Studies suggest vitamin E could protect your kidneys from damage and improve their function. Most berries have a moderate potassium content ranging from 77 to 121 mg per 100 g serving. However, portion control is important. The U.S. Department of Agriculture, USDA, recommends eating about 1 cup of berries daily. Berries are versatile and can be enjoyed any time of the day. They make a delicious addition to breakfast yogurt and smoothies. Or you can enjoy them as a healthy snack. While berries are a great source of vitamin E and potentially beneficial for kidney health, damaged kidneys might be unable to remove excess vitamin E from the body. This buildup can lead to serious side effects like dizziness, nausea, and even death. If you have kidney disease, talk to your doctor before taking vitamin E supplements. When purchasing berries, choose plump, brightly colored varieties free of mold. Fresh berries are best consumed within a few days. Gently rinse berries before eating them. 6. Grapes. Grapes contain resveratrol, a potent antioxidant with anti-inflammatory properties. Resveratrol may help protect kidney cells from damage caused by oxidative stress and inflammation. A single serving of grapes, 1 cup, contains 286 mg of potassium. Eating grapes in moderation can help maintain healthy blood pressure levels. This may, in part, be due to their potassium content. High blood pressure is a major risk factor for kidney disease. So keeping your blood pressure in check supports kidney health. 1 cup of grapes is the recommended daily serving size. You can enjoy them fresh or frozen or pair them with cheese for a balanced protein and carbohydrate combination. Grapes provide 15.48 grams of sugar per 100 gram serving. For Americans, that means nearly 4 teaspoons of sugar in a half cup of grapes. So moderation is key, especially if you have diabetes or prediabetes. Choose firm, plump grapes firmly attached to the stem. Store grapes in the refrigerator's crisper drawer and wash them thoroughly before eating. 5. Watermelon. Next on our list of kidney-friendly fruits is watermelon. Did you know that over 90% of watermelon is water? Eating this juicy and tasty fruit is a fantastic way to stay hydrated and flush out toxins. Mild dehydration can temporarily hike your creatinine levels. When you're dehydrated, your blood volume decreases. https, making it harder for the kidneys to remove waste products effectively. A study on patients hospitalized for diarrheal illness found they were at increased risk of developing acute kidney injury, or AKI in short, because of fluid depletion. Since dehydration can contribute to kidney problems, eating watermelons can keep your kidneys functioning at their best, especially if you have diarrhea. Watermelon also contains L-citrulline, an amino acid that converts to L-arginine, which helps build body protein. L-arginine may help improve blood flow, potentially benefiting kidney health. Eating watermelon is a fantastic way to ensure your kidneys function at their best. 2 cups of watermelon are recommended for daily use. You can enjoy it fresh, cubed into salads, or blended into a refreshing drink. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 4. Pineapple. Pineapple contains an enzyme called bromelain, known for its anti-inflammatory properties. Inflammation can contribute to various health problems, including kidney disease. Bromelain may help reduce inflammation and potentially benefit kidney health. Additionally, pineapple is a good source of vitamin C. It provides 78.9 milligrams of vitamin C per 165 gram serving, which translates to 48% per cup. This vitamin C boost can help protect against kidney cell damage and keep kidney disease, like kidney stones, at bay. A single serving of pineapple is around 1 cup and contains 180 milligrams of potassium. You can enjoy pineapple diced, sliced, grilled, or added to smoothies. If you plan on consuming pineapple, note the precautions. Bromelain may interact with certain medications, particularly blood thinners. If you take any medications, discuss pineapple consumption with your doctor. Pineapple can irritate the mouth in some individuals, so try eating it in moderation. Choose a pineapple with slightly yellow leaves at the crown. If not quite ripe, fresh pineapple can be stored at room temperature until ripe, then refrigerated. 3. Cherries. Cherries are a rich source of anthocyanins, the same antioxidants in berries. These antioxidants help combat free radicals and may protect kidney cells from damage. Like apples, cherries are quercetin-rich, giving the fruit anti-inflammatory properties. 1 cup of cherries is the recommended serving size. Enjoy them fresh and add to salads, yogurt, or baked goods. However, remove the pits, as they can be a choking hazard. One thing to be aware of is cherries contain potassium. Foods and drinks with more than 66% of potassium per cup are considered high, while those with 40% or less are considered low. A half cup of cherries provides nearly 30% of potassium, which falls within the low potassium range. However, consult your doctor about suitable serving sizes if you have advanced kidney disease or are on potassium restrictions. Choose plump, brightly colored cherries with fresh green stems. Store cherries in the refrigerator and wash them thoroughly before eating. 2. Lemons. While many people do not eat raw lemons because of their sour taste, lemons, their high vitamin C content offers potential benefits for kidney health. Lemons also contain citric acid, which may slightly increase the amount of citrate in your urine. Citrate helps prevent kidney stones by creating a less favorable environment for stone formation in your urine. potassium citrate is a common treatment for kidney stones. Thus, consuming a diet rich in citrus fruits might offer similar preventive advantages. Because of their acidic nature, drinking large quantities of lemon juice may not be suitable for everyone. A squeeze of fresh lemon juice can add flavor to water or tea. You can also use lemons in salad dressings, marinades, and baking. A word of caution: excessive consumption of lemon juice can irritate the lining of the esophagus and stomach. If you experience heartburn or stomach discomfort, limit lemon intake or consult your doctor. Studies show that lemon juice can also erode tooth enamel, so you should rinse your mouth with water after drinking lemon juice. Choose lemons with a firm, smooth rind and a bright yellow color. Store lemons at room temperature or in the refrigerator's crisper drawer. Juice, zest, or slice lemons to use in various dishes and beverages. 1. Pears. The last fruit on our list is pears. Pears are a good source of fiber, providing 3 grams per 100 gram serving. Fiber can help promote healthy digestion and the elimination of toxins, indirectly benefiting kidney function. Studies show that pears contain antioxidants like caffeic acid. Caffeic acid directly scavenges free radicals, which may help protect kidney cells from damage. 1 medium pear is the recommended serving size, around 206 milligrams potassium. Enjoy pears whole or sliced. For more versatile, tasty dishes, toss diced pears into salads, or try grilling them for a warm and flavorful dessert. Bear in mind, some pear varieties can be high in fructose. If you're diabetic, pre-diabetic, or watching your sugar intake, limit your consumption to no more than 3 times a week. Pears also have moderate potassium content. Learn more at www.cdc.gov. If you have advanced kidney disease or are on potassium restrictions, consult your doctor about suitable serving sizes. When shopping for pears, choose firm, smooth varieties with unblemished skin. Store pears at room temperature until ripe, then refrigerate. Precautions. Most fruits are kidney-friendly. They contain nutrients, like fiber, that help your kidneys eliminate waste. However, some precautions should be taken before consuming these fruits. The first one is to watch out for portion sizes. For more information, visit www.fema.gov. Fruits contain potassium and phosphorus, so moderation is key, especially if you have kidney issues. Talk to your doctor about the right portion sizes for you. Symptoms of high creatinine levels. High creatinine levels often don't cause noticeable symptoms in the early stages of kidney disease. However, symptoms of advanced kidney disease may include fatigue, loss of appetite, foamy urine, frequent urination, high blood pressure, nausea or vomiting, swelling in the ankles, trouble sleeping. See a doctor if you experience any of the symptoms we mentioned, especially if you have risk factors for kidney disease, like kidney stones. If your routine blood test results show a high creatinine level, your doctor will investigate further and recommend the next steps. Although a blood draw might cause discomfort, the creatinine test is a safe and common blood test with minimal risks. 3 ways to lower creatinine levels. Consuming the fruit mentioned in the video is a positive step towards supporting kidney health. However, as mentioned at the start of the video, there are other holistic approaches to keep your kidneys functioning at their optimum. One method is to consume a kidney-friendly diet that limits sodium, potassium, animal-based protein, and phosphorus intake. You can speak to your doctor or dietitian to create a personalized plan. Another approach is managing blood pressure, staying hydrated, exercising. maintaining a healthy weight, and limiting alcohol and tobacco use. Medication may sometimes be needed to manage underlying conditions affecting kidney function. Your doctor may prescribe diuretics to help remove excess fluid and waste products from the body. In severe cases of kidney failure, dialysis may be needed to artificially filter the blood. We've explored a variety of delicious fruits that can be incorporated into a kidney-friendly diet. These include apples, cranberries, berries, grapes, watermelon, pineapple, cherries, lemons, and pears. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Everything we've discussed in this video might be wasted if you don't watch the video on the screen. Here, we share the worst 22 foods that can ruin your effort to heal proteinuria and kidney disease. We also offer tips on how to still enjoy them or find great alternatives. See you there. Stay informed, stay healthy. 9 skin signs that may indicate your kidneys are damaged. It is important to know that skin changes usually appear when you've already been having problems with your kidneys for a while. Remember, early detection and treatment can make a world of difference in kidney health. According to the latest studies, more than 800 million people worldwide may experience chronic kidney disease. So, if you have any risk factors, such as high blood pressure, diabetes, or obesity, or if you suspect kidney problems, check for these skin signs and discover helpful tips for keeping your skin healthy. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Skin signs of kidney disease. Some skin changes are specific to kidney disease, whereas other changes in the skin are non-specific and may be associated with a variety of medical problems. 1. Itchy skin or pruritus. This is one of the most common skin symptoms in people with kidney damage, occurring in as many as 40% of people with end-stage renal disease, or ESRD for short. But what causes this itchiness? When the kidneys cannot effectively filter out waste products, urea accumulates in the blood. This buildup can lead to uremic pruritus, the medical term for itching caused by kidney disease. Itchy skin can occur anywhere on the body, but it commonly affects the back, legs, and arms. It is intensified by sweat, dry skin, and heat. While it may sound mild, this itchiness can be so intense and persistent that it can lead to a poor quality of life. When the pruritus is severe, the urgent need to scratch leads to more severe skin problems. Scratching may cause scrapes, or excoriations, on the skin, thicken, leathery skin, or skin lichenification, or raised bumps, or prurigo nodularis. Ongoing scratching can cause lesions to bleed. And a compromised skin barrier becomes an easy way for bacteria to enter and lead to more severe infections. Are you enjoying our video so far? If so, please give us some hints by dropping a like and we'll make more content like this. 2. Rashes. Rashes are also a common skin sign in people with kidney damage caused by poor elimination of toxins that build up in the skin. Acquired perforating dermatosis is a type of rash that appears in individuals with end-stage kidney damage. In the form of small, pigmented, itchy bumps with a scaling center. These bumps can usually be found on arms and legs. Less commonly, they may be found on the trunk, scalp, and buttocks. As the bumps heal, new ones can appear, creating lesions in multiple stages of healing, which may join together to form larger patches. Although these rashes are often itchy, you should avoid scratching because it can lead to worsened skin conditions. 3. Blisters. Blisters may also occur in people with kidney damage. They often appear as fluid-filled sacs on exposed areas, such as the backs of the hands, forearms, or, less often, on the feet and the face. Kidney damage is just one potential cause of blisters. Blisters can be caused by infections, medications, poor diet, and heavy alcohol intake. Blisters associated with kidney damage can vary in size and severity. They may be accompanied by other symptoms such as pain, redness, and swelling. Unfortunately, when blisters heal, they dry up and develop a crust that later peels away, usually leaving a scar and skin discoloration. 4. Calcium deposits. Calciphylaxis is one of the most severe skin conditions associated with kidney damage. It occurs when calcium accumulates in small blood vessels, leading to painful sores and ulcers. It's a rare but serious condition that occurs in up to 4% of patients undergoing dialysis and requires immediate medical attention. The exact cause of calciphylaxis remains unclear, but several factors can increase the risk. High blood calcium levels. This often happens due to imbalances in calcium and phosphate. 2. Dialysis. Long-term dialysis patients are more at risk. 3. Obesity. Higher body mass index, or BMI, can be a contributing factor. 4. Medications. Certain medications can impact calcium metabolism. Patients with calciphylaxis describe painful pink or purple bumps or plaques that develop into deep, painful ulcers covered with black crusts, usually located on the abdomen, buttocks, and legs. Another type of calcium accumulation is represented by calcinosis cutis, which refers to calcium deposits under the skin. Calcium. These are usually firm white nodules near joints that may break through the skin and release a white chalky discharge. Calcinosis cutis are usually not painful unless they are located in the fingers or toes. 5. Dry skin xerosis. Dry skin or xerosis is one of the most common skin signs of kidney damage. However, dry skin is nonspecific as it can be caused by a number of conditions besides kidney damage. Dry skin occurs in 50–80% of individuals on dialysis. And here are a few common causes. 1. Poor hydration. Decreased sweat gland activity. 3. High levels of vitamin A. And 4. Long-term use of diuretics. Xerosis usually occurs in those who have been dealing with kidney damage for a while and are on dialysis, which often causes skin to become dry, rough, and scaly. People with xerosis also experience tight skin that can easily crack, leading to exposed entryways for bacteria. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 6. Swelling. The kidneys have many functions. One of the most important ones being the elimination of excess water and salt from our bodies. If your kidneys are damaged, water and salt may not be eliminated properly, leading to a buildup of fluid. This water and salt retention causes swelling and puffiness, especially in the hands, feet, and face. 6. Swelling. If your legs feel puffier than usual, press them with your finger to see if it leaves an indentation, called pitting edema. If you experience swelling and puffiness, you should see your healthcare provider to have your kidney function evaluated. 7. Changes in skin color. The presence of kidney damage can lead to a buildup of waste products in your bloodstream, which may cause your skin to change color, often with gray or yellow hue. This discoloration results from the toxins that are not being filtered and excreted in the urine. Skin hyperpigmentation may also occur as a result of a buildup of melanin, and it may be seen as a dark brown color. Skin pallor, or paleness, is commonly observed in individuals with chronic kidney disease caused by anemia. Another skin discoloration related to kidney damage is uremic frost, a white, powdery substance left on the skin's surface after sweat dries. Excessive scratching may also change the color or texture of your skin. 8. Nail disorders. Many medical conditions can cause nail changes, including kidney disorders. In a study of 100 patients, nail changes were found in 60% of individuals with CKD. In another study of 101 patients with severe renal disease who were on dialysis, 8. Nail disorders. Hair, mucosal, and nail disorders were found in 23–45% of the patients. On your finger or toenails, you may notice one white transverse band, called Mees line, or multiple bands, called Morch's lines. These can appear in people with kidney damage due to stress or low protein levels in their blood. Another frequent finding is the half and half nail disorder, also known as Lindsay nails, characterized by a brownish color at the top of the nails from increased melanin and a white or pink color at the bottom of the nails due to an increased number of small blood vessels. Less common changes are splinter hemorrhages, which are small, red or brown lines under the nails that resemble splinters. They can be a sign of underlying health issues including kidney damage, and they are caused by small blood clots that damage the capillaries under the nails. Keeping nails trimmed and moisturized can reduce the risk of nail disorders. 9. Hair disorders. One of the most troubling symptoms for individuals with kidney damage is hair loss. This condition, medically known as alopecia, can have an impact on self-esteem and quality of life. Hair loss can result from several factors associated with kidney disease. 1. Nutritional deficiencies. Kidney damage often leads to imbalances in essential vitamins and minerals, such as iron and zinc, which are critical for healthy hair growth. 2. Hormonal imbalances. The kidneys regulate many different hormones that affect hair growth. When the kidneys are not working properly, it can lead to hormone dysregulations, which can affect hair growth cycles. 3. Medications. Some of the medications prescribed for kidney disease, including certain blood pressure medications and immunosuppressants, can contribute to hair thinning and loss. Dehydration and dialysis treatment can strip hair of natural oils, making it more dry and brittle. It is important to remember that hair loss and hair shedding can occur from a variety of medical conditions. If you are experiencing a sudden increase in hair shedding or patches of alopecia, see your healthcare professional to help determine the cause. What can you do? We covered many skin signs, some more severe that would make us call our doctor, and other more common ones that may not necessarily be related to kidney damage. So, the question that follows is, when to seek medical help, and who to consult for these symptoms. As this video shows, some skin symptoms are more specific or serious, and clearly require a visit to a healthcare provider. But what do we do about those less alarming symptoms that we might ignore or confuse with other causes? Kidney damage affects many people, but there are some risk factors for kidney disease that you should consider when you notice skin changes. If you are over 60 with other conditions such as high blood pressure, diabetes, or obesity, pay close attention to your skin and nail changes, even seemingly ordinary ones. You should contact your primary care doctor at any sign of skin changes. For more information, visit www.fema.gov. Blood and urine tests will help diagnose kidney problems, allowing you to start proper treatment recommended by a nephrologist or kidney doctor. You must communicate well with your doctor, who can explain your condition and how to prevent further skin changes. If you have severe or persistent skin symptoms, you should see a dermatologist or skin doctor who can collaborate with your nephrologist. How can I manage these symptoms by myself? After being diagnosed, you should initiate proper treatment, but you should not rely only on medication. Our lifestyle and day-to-day practices play a key role in the healing process. You need to make important changes to manage kidney damage. These changes include diet and nutrition. Eating a balanced, kidney-friendly diet is important for your skin health. Monitor your salt, protein, phosphate, and calcium intake. Quit smoking and limit or avoid alcohol consumption. Search for new recipes or talk to a nutritionist who can recommend dishes based on your favorite flavors. 2. Hydration. Drinking enough water can help keep your skin hydrated and reduce dryness. However, if you have kidney issues, especially if you are on dialysis, overhydration can lead to fluid buildup. To manage thirst when restricting fluids, eat pieces of frozen fruit, drink small sips, or rinse your mouth with mouthwash. Consult your healthcare provider to determine your ideal water intake. 3. Moisturizing. To combat dryness and itchiness, moisturize your skin at least once a day. Use fragrance-free hypoallergenic moisturizers to avoid irritation. Emollients that contain salicylic acid or urea and a gentle skincare regimen can be useful. 4. Avoiding hot showers and baths. Hot showers can strip your skin of its natural oils, making it dry and itchy. Avoid long baths and try taking short showers with lukewarm water. 5. Avoiding harsh skincare products. Avoid using harsh soaps and skincare products that can irritate your skin. Stick to gentle, fragrance-free products designed for sensitive skin. 6. Sun protection. Sun damage can worsen skin problems, especially if your skin is sensitive. Use sunscreen with at least SPF 30 to protect your skin, even on cloudy days, and reapply it throughout the day. 7. Comfortable clothing. Wear loose-fitting, comfortable clothing made from natural fibers like cotton. This can help prevent irritation and allow your skin to breathe. 8. Regular checkups. Regular checkups are essential for monitoring your kidney function and overall health. Discuss any new symptoms or concerns with your doctor during these visits. What is the most important takeaway from this video? When it comes to kidney health, recognizing skin signs is crucial for early diagnosis and effective management. Kidney damage often causes specific symptoms like itchy skin, rashes, blisters, and calcium buildup in vessels and skin. It can also lead to nonspecific signs such as dry skin, swelling, changes in skin color, nail and hair disorders. Each of these symptoms signals potential underlying renal problems. For more information, visit www.fema.gov. Itchy skin, for example, affects 90% of people on hemodialysis due to the buildup of waste products like urea. Similarly, rashes, blisters, and calcium deposits signal that the kidneys struggle to eliminate toxins effectively. Although less specific, nail and hair disorders should not be ignored, especially in those with associated risk factors, as they can signal deteriorating kidney function. People with kidney disease should watch for these symptoms, especially if they are at high risk, due to factors like age over 60, diabetes, high blood pressure, or obesity. Early detection can significantly improve treatment outcomes. Seek immediate medical help when these signs appear. Blood and urine tests will confirm the diagnosis and pave the way for proper treatment, often involving collaboration between a nephrologist and dermatologist. Managing these symptoms involves more than just medical treatment. Lifestyle changes play a crucial role. These include maintaining a balanced diet, staying hydrated without excess, using gentle skincare products, avoiding hot showers and harsh soaps, and ensuring proper sun protection. Such changes can greatly improve your quality of life and skin health. In conclusion, recognizing and addressing skin signs linked to kidney damage on time helps diagnosis and management of the condition. Adopting a proactive approach helps manage the symptoms and improves overall kidney health and quality of life. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Have you seen any signs from our video or worried about kidney disease? Your kidneys might need a natural boost. Check out the video on the screen for the top 5 fruits that can help cleanse your kidneys. We also offer tips to get the most from them. See you there. Stay informed. Stay healthy. Avoid these 7 plant-based foods that can damage your kidneys. In recent years, many experts have suggested the benefits of a plant-based diet in reducing the strain on your kidneys. But just because something is from a plant doesn't mean it's good for your kidneys, particularly if you have kidney disease. In reality, some plant-based foods can actually pose risks, and cutting back on them would bring lasting rewards. Watch this video to learn 7 plant-based foods you should avoid to protect your kidneys. Before we dive in, please note all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. 7. Seed oils. Seed oils are plant-based cooking oils obtained from seeds. Examples are rice bran, canola, corn, cottonseed, grapeseed, soybean, sunflower, safflower, and peanut oils. These oils are promoted as valuable lipid sources due to their healthy fatty acid content and bioactive compounds. However, these oils have undergone extensive processing, including bleaching, refining, and heating, to extract and clean them before they can be used for cooking and baking. Refining can strip away essential nutrients like antioxidants and sometimes produce unwanted compounds. One example is trans fatty acids, one of the most harmful compounds for your kidneys and overall health. More concerning, seed oils can contribute to inflammation in the body due to their high omega-6 fatty acid content. Inflammation is the root cause behind a long list of health conditions like kidney disease, arthritis, heart disease, and diabetes. Small amounts of omega-6 fatty acids are necessary for your overall health. However, excessive consumption, typical in Western diets, can disrupt the balance between omega-6 and omega-3 fatty acids, leading to health problems such as kidney damage. Fats are divided into saturated and unsaturated types. Unsaturated fats found in oils like olive oil are healthier, offering benefits such as improved cholesterol and heart health. Saturated fats found in animal products and some plants like coconut should be limited. Replacing saturated fats with unsaturated ones can minimize the harm caused by seed oils. Opt for unrefined oils, such as extra virgin olive oil, which retain more natural nutrients, flavor, and aroma. Because they are extracted using methods like cold pressing without high heat or chemicals, unrefined oils are tastier, healthier, more natural, and free from harmful additives. This purity and nutrient retention support overall health, including kidney function. 6. Canned vegetables and canned soups. Canned soups and vegetables are commonly consumed because of their low cost and convenience. However, these foods typically contain high levels of sodium for preservation, which can be problematic for those with kidney disease. When the kidneys are not functioning properly, they cannot effectively filter out excess sodium from the blood. This leads to a buildup of sodium, which can increase blood pressure and put additional strain on the kidneys. It is worth emphasizing that canned foods often contain added sugars or chemical additives. This is why individuals with kidney disease should avoid or limit canned foods, including canned vegetables. Instead, look for fresh or low-sodium alternatives. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 5. Chips and pretzels. Baked chips, despite their reputation as a healthier alternative to the fried version, can still pose risks to kidney health. Baked chips are highly processed and low in fat, making it easy to overeat without feeling full. Pretzels are processed baked bread snacks, which can raise blood sugar levels and promote fat storage. These effects can contribute to kidney damage over time. Potato chips and pretzels are also low in essential nutrients like fiber and protein, and can contribute to weight gain and obesity, potentially damaging your kidneys over time. Worse still, both chips and pretzels can contribute to high sodium intake, which can strain the kidneys by causing fluid retention and elevated blood pressure. High salt intake may worsen already existing kidney damage and increase the risk of cardiovascular complications like heart attacks and strokes. Try to moderate your intake of these foods in favor of healthier snack options to support kidney health. 4. Ketchup. Ketchup is made from tomatoes, which are high in potassium, and excessive potassium intake can be problematic for those with poor kidney function. Also, ketchup is often high in added sugar and sodium, which can contribute to high blood pressure and strain on the kidneys. 1 tablespoon, which is 17 grams, can contain 180 milligrams of sodium and 4 grams, which is equivalent to 1 teaspoon of sugar. It's best to choose options that are low in these ingredients, especially those that don't include high fructose corn syrup. The sugar in ketchup, like high fructose corn syrup, can lead to obesity and insulin resistance, making kidney function worse. Ketchup also has lots of phosphorus, which isn't good for individuals with kidney issues. Too much phosphorus can cause problems since damaged kidneys struggle to filter it out. It's important to avoid other store-bought condiments that might cause similar adverse effects. This includes salad dressing, barbecue sauce, and soy sauce, as they often contain high levels of sodium, sugars, or chemical additives. Rather than topping your favorite summer dishes with these condiments, consider using salsa. Choose fresh, salt-free salsa from the store, or make your own at home. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 3. Instant noodles. Instant noodles are pre-cooked, dried noodles that are popular worldwide due to their convenience, long shelf life, variety of flavors, and reasonable cost. However, they are often criticized for being unhealthy due to their high sodium, carbohydrate, and trans fat content, and lack of essential nutrients like fiber, vitamins, and minerals. In 2017, Nutrition Research and Practice published a study involving 397 college students in Seoul, aged 18 to 29. The study aimed to understand how eating instant noodles affects heart and metabolic health. They found frequent instant noodle intake was linked to elevated levels of blood triglycerides and sugars and increased blood pressure. These effects can potentially cause diseases that lead to kidney damage. Instant noodles are a perfect example of ultra-processed foods, or UPFs for short, which can damage kidney function. UPFs are typically high in calories, refined carbohydrates, sugar, salt, chemical additives, and trans fats and low in dietary fiber and essential nutrients. A 2022 study published in the American Journal of Kidney Diseases analyzed data from the Atherosclerosis Risk in Communities Study, a major research initiative conducted in the United States. This study involved 679 middle-aged adults without kidney disease at baseline. After analyzing, the researchers found that each additional serving of ultra-processed foods, including canned soup, was linked to a 5% higher risk of chronic kidney disease, or CKD for short. These findings highlight the potential harm of canned soup and other ultra-processed foods on kidney health. A study conducted in Korea found that people consuming the most UPFs had a higher prevalence of CKD. The results demonstrated that every 6% increase in UPF consumption was linked with a 6% higher prevalence of CKD. This association may be due to the harmful ingredients found in UPFs, such as hydrogenated oils and chemical additives, which can cause oxidative stress and inflammation. Frequent consumption of instant noodles can harm the kidneys due to their high phosphorus content, which can raise serum phosphorus levels. Elevated serum phosphorus is linked to increased mortality and cardiovascular events. Efforts are being made to address these concerns and develop healthier versions. In Malaysia, for example, researchers have explored the use of composite flours, incorporating locally available ingredients like seaweed powder to improve the nutritional value and quality of instant noodles, while reducing dependence on imported wheat flour. 2. Frozen meals. Pre-packaged vegan-vegetarian frozen meals frequently contain lots of salt, potassium, and phosphorus, which can be bad for patients with kidney disease. Excess salt and other preservatives are often added to make these meals taste better and last longer. Moreover, excessive potassium intake can be problematic for individuals with compromised kidney function, as mentioned earlier, because the kidneys struggle to properly regulate potassium levels in the blood. However, plant-based diets in kidney disease have been shown to be beneficial, as the potassium in fresh whole plants are paired with fiber, which prevents its absorption. Talk with your dietitian about the right plant-based diet for you. Similarly, additives containing phosphorus in processed frozen foods can contribute to elevated phosphorus levels in the blood, potentially leading to bone and heart complications in those with kidney disease. Therefore, frozen meals are generally not a good choice for people concerned about kidney health, especially if consumed regularly. To make frozen meals less harmful to kidney health, choose those with lower sodium and reduced potassium and phosphorus content. This involves carefully reading labels and selecting products with minimal processed ingredients. A better option is to prepare homemade meals using fresh whole food ingredients, allowing for greater control over nutrient intake. Try cooking large batches of kidney-friendly vegetarian or vegan dishes and freezing individual portions for later consumption. By prioritizing fresh, whole foods and mindful meal planning, you can enjoy a kidney-friendly diet while minimizing potential harm. 1. Chocolate bars or energy bars. While cocoa contains phenolic antioxidants and flavonoids that can help support the function of your blood vessels, chocolate bars should be consumed with caution. Chocolate bars have high levels of saturated fats and added sugar. These components contribute to high blood sugar, high blood pressure, and weight gain, which are common triggers for kidney disease. Chocolate bars and energy bars are also considered UPFs, which are linked with an increased risk of CKD and worsen complications in patients with CKD. As mentioned earlier, UPFs are typically high in energy, low in nutritional value, and contain additives that may be harmful to kidney health. Energy bars, often consumed for replenishing electrolytes lost during exercise, can pose significant dangers to kidney health. Similar to energy drinks, they often contain high amounts of sugar to provide a quick energy boost. Also, the combination of high sugar and other additives in energy bars leads to conditions that can cumulatively strain the kidneys. Thus, long-term consumption of energy bars can accelerate kidney damage. Therefore, it is essential to minimize your consumption of these processed bars and consider fresh fruits and other healthier alternatives. Are your kidneys damaged? Healthy kidneys filter about half a cup of blood each minute, getting rid of waste and excess water to produce urine. The urine travels from the kidneys to the bladder through two thin muscular tubes called ureters. One on each side of the bladder. The bladder serves as a reservoir, temporarily storing the urine. Together, the kidneys, ureters, and bladder make up the urinary system. When your kidneys are damaged, waste and fluid build up. Over time, this can lead to kidney disease and kidney failure, which can be either acute or chronic. Acute kidney failure is usually short-term and reversible, while chronic kidney failure is a long-term condition that is progressive. Symptoms of kidney damage can include nausea, vomiting, fatigue, sleep problems, changes in urination, decreased mental sharpness, muscle cramps, swelling of feet and ankles, itchy skin, and high blood pressure. These signs might not manifest until irreversible damage has occurred due to the kidney's ability to compensate for lost function. Kidney problems can cause anemia and bone and mineral disorders, such as hyperkalemia, which can be deadly. Additionally, kidney failure can heighten the risk of heart disease or stroke. Without treatment, kidney failure is fatal. Doctors rely on biomarkers like creatinine levels, glomerular filtration rate, or GFR, and protein in the urine to assess kidney function. Newer biomarkers such as kidney injury molecule and neutrophil gelatinous-associated lipocolin show promise for early detection of kidney damage. Triggers for kidney disease include high blood pressure, high blood sugar, and high blood cholesterol levels. The increased force from high blood pressure injures the filtering units of the kidneys. Elevated blood sugar from diabetes can cause damage to small blood vessels in the kidneys, which harms the filters. Additionally, cholesterol forms plaques along the artery walls, blocking blood flow to the kidneys, which impairs their function and also causes protein loss in the urine. Other diseases and environmental factors can also contribute to kidney damage. Obesity increases the risk of chronic kidney disease, or CKD, by lowering urine pH, causing chronic inflammation, and disrupting fat metabolism. It also worsens high blood pressure, insulin resistance, and glucose intolerance, further raising the CKD risk. While CKD can be caused by various factors, including diabetes and high blood pressure, dietary choices play a significant role. This video has highlighted some plant-based foods to avoid, emphasizing the importance of opting for less processed alternatives. The one thing all of these foods have in common is that they are processed. From seed oils to flavored instant oatmeal, many processed foods contain additives that can worsen kidney disease. To maintain healthy kidneys, swap out high-sodium condiments like ketchup for homemade sauces with fresh herbs. Opt for antioxidant-rich fruits and vegetables. Choose lean proteins with less saturated fat, and stay hydrated with water. By prioritizing whole, nutrient-rich foods and limiting processed options, you can support your kidneys and prevent pre-existing kidney conditions from getting worse. Remember, consulting with a healthcare professional is necessary. Especially if you have an existing kidney condition, your doctor and registered dietitian can provide personalized guidance to help you make informed dietary choices and maintain optimal kidney health. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Have you seen any signs from our video or worried about kidney disease? Your kidneys might need a natural boost. Check out the video on the screen for the top 5 fruits that can help cleanse your kidneys. We also offer tips to get the most from them. See you there. Stay informed. Stay healthy. High creatinine level indicates kidney disease, and keeping it low can help you avoid the pain and costly treatments associated with advanced kidney issues, such as dialysis. Try these 7 simple habits to lower your creatinine level and maintain healthy kidneys. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. 7. Avoid over-the-counter anti-inflammatories. People with pain, cold, flu, and fever symptoms often take over-the-counter, or OTC for short, non-steroidal anti-inflammatory drugs, or NSAIDs for short, which include ibuprofen, or Advil, Motrin, naproxen, and aspirin. Medications containing NSAIDs can be damaging to people with kidney disease. In other words, when the kidneys aren't functioning properly, they may rely on chemicals called prostaglandins to help keep the blood vessels open and improve blood flow. One of the results of NSAIDs is the blocking of the production of prostaglandins in the kidney, thereby preventing the needed vasodilation and necessary blood flow. A 2021 study published in the journal Healthcare in Basel examined how 18 months of low-dose aspirin use affected patients with severe kidney disease who were not on dialysis. Out of 12,000 patients, the 3,000 who took aspirin had a 15% higher risk of starting dialysis. Low-dose aspirin is often prescribed to prevent cardiovascular disease in patients with kidney disease, but it may also worsen outcomes for those with severe kidney disease. Furthermore, having caffeine along with NSAIDs may increase the risk of kidney damage. Caffeine raises blood pressure, causes renal vasoconstriction, and increases urination and dehydration. If you do take NSAIDs, make sure to drink plenty of water, or even better, avoid them if you have chronic kidney disease, or CKD for short. If you have CKD, you may be wondering what medications are safe to use to treat your pain. In early kidney disease stages, taking NSAIDs for a few days may be low risk. However, your kidney specialist should supervise your longer-term treatment. Taking NSAIDs at higher doses increases the risk of electrolyte imbalances, high blood pressure, and worsening kidney damage in people with advanced kidney disease. NSAIDs treatment should be personalized based on the severity of your kidney disease, overall health, the medications you are taking, and your age. Ask your doctor for advice about taking OTC NSAIDs to learn about their safety and any alternatives you may use. Before taking OTC medications, check each product's label for its contents or warnings. 6. Eat more fiber. Increasing fiber in your diet may significantly prevent chronic diseases that cause kidney damage. One of fiber's many benefits includes lowering the amount of creatinine in the body. That's because consuming dietary fiber helps feed gut bacteria that help break down creatinine and reduce inflammation. Fiber also helps prevent constipation and balance cholesterol, blood sugar, and blood pressure. A 2022 meta-analysis published in the journal Nature reviewed the impact of fiber intake on kidney damage, showing mixed results. The variability may lie in the difficulty of studying individual nutrients. One study of over 3,500 patients showed no effect of dietary fiber intake on creatinine levels. However, another study showed fiber's positive impact on disease prevention and inflammation reduction, which also helps decrease the rates of kidney disease. Another study found that individuals with kidney disease who reduce their consumption of a Western diet while adopting a plant-based diet have higher survival rates. The Dietary Guidelines for Americans, or DGA, recommend that most adults consume 28 grams of fiber daily. Fiber is present in all plant food sources, including fruits, vegetables, whole grains, and legumes such as beans, chickpeas, and lentils. Adults should eat 3 to 5 ounces of whole grains daily and 1 to 3 cups of legumes weekly. In addition, they should include 1/12 to 2/12 cups of fruit and 2 to 4 cups of vegetables in their diet daily. A dietitian can provide appropriate recommendations for people who must watch their blood potassium levels, such as patients on dialysis. Examples of foods that contain lower potassium and higher fiber include different food categories, including legumes, vegetables, such as cooked broccoli, cabbage, radishes, beets, and cauliflower, and specific fruits, such as pears, apples, strawberries, and watermelon. However, Brazil nuts, sunflower seeds, and oats may also be beneficial. To reduce more than half of the potassium in your produce, wash chopped fruits and vegetables in cold water. Chopping it will increase the exposed surface area for rinsing. Western diets are typically low in fiber. Switching to a whole food diet rich in plants can boost fiber intake and protect kidney health. Are you enjoying our video so far? If so, please give us some hints by dropping a like and we'll make more content like this. 5. Limit salt intake. Your doctor has probably asked about your salt intake because eating too much salt may lead to high creatinine levels. While sodium, an element of salt, is necessary for healthy bodily functions, most Americans consume excessive amounts. Most of the sodium in the American diet comes from processed foods and restaurant meals rather than natural sources or salt added to home-cooked meals. According to a 2020 study published in the International Journal of Molecular Sciences, people in early to severe stages of CKD can benefit from a low-sodium diet. In the early stages, the diet lowered proteinuria, or protein in urine, and intensified the effectiveness of blood pressure medications. In the later stages, with reduced kidney function, the salt-restricted diet helped prevent fluid overload and reduced the quantity of dialysis sessions needed. Excess salt increases the body's fluid and blood pressure. The high pressure and excess fluid within the kidneys cause its blood vessels to narrow. The force of blood flow on narrowed vessels damages them and limits the blood flowing through the filtration system. Waste, including creatinine, may build up in the body due to inadequate filtration, causing creatinine levels to rise over time. Limiting salt intake is vital for people who are on dialysis to prevent high blood pressure and heart enlargement. The reason for this is that dialysis machines may not fully balance excess salt in the body. Following a low-sodium diet may lead to better management and outcomes for people with kidney disease. For individuals aged 14 and older, without health concerns, the DGA recommends limiting sodium intake to 200-300 milligrams per day, which equals 1 teaspoon of table salt. Patients with kidney disease should eat less than 500 milligrams daily, or just under 3/4 of a teaspoon of table salt. A diet consisting mainly of whole foods will typically reduce your overall salt intake. Foods high in sodium tend to be processed, packaged, canned, or cooked in restaurants. Create a habit of eating low-sodium whole foods and reading food labels. Avoid packaged foods with more than 400 milligrams of salt per serving, which can be challenging. Also, use less salt when seasoning your food, and remember that sea salt and regular salt have equal sodium content. Lastly, try using herbs and spices to flavor your meals instead of salt. 4. Exercise regularly, but avoid overexertion. People with kidney disease typically have low levels of physical activity. However, a regular exercise program has been shown to improve creatinine levels and GFR. Exercise supports kidney function by reducing inflammation and slowing tissue damage caused by waste product buildup. Besides that, it may also help increase blood flow to the kidney's small blood vessels and tubules. Many studies show the benefits of appropriate exercise in patients with kidney disease. A study published in 2022 reviewed previous research to determine exercise guidelines for individuals with kidney disease. The researchers found that people who regularly did safe aerobic and strength training over 6 months achieved the most benefits and improvement. An exercise training program should be tailored to your fitness level, considering your breathing, heart rate, and sweating response. It's best to start your exercise routine with a low-intensity activity. This can include walking, swimming, or lifting light weights with many repetitions. Once your body becomes comfortable with the activity, you can slowly increase it by varying the frequency, length, and intensity of your exercise. Gradually, you might even work your way up to high-intensity exercises like running, mountain biking, vigorous dancing, or strength training with heavier weights. Try breaking up your exercise sessions throughout the week to achieve the best results. Make sure you stay hydrated and prevent yourself from overheating, especially in hot environments. This can help prevent overexertion, which could lead to kidney complications. Also, patients with kidney disease, diabetes, or heart disease should let their bodies adjust to exercise before adding intensity. If you experience lightheadedness, chest tightness, pain, or can't catch your breath while exercising, stop your activity immediately and consult your health practitioner before resuming. Adding regular exercise to your treatment plan can keep you healthy and help manage your chronic kidney disease, or CKD for short. 3. Stop smoking. The effects of smoking on kidney health are well known. Kidney disease worsens faster in people who smoke and have a GFR of less than 45 milliliters per minute. Chemicals found in cigarette smoke, such as nicotine, can narrow the kidney's tiny blood vessels. In addition, smoking long-term can eventually cause conditions such as atherosclerosis and renal artery stenosis. These conditions result in a hardening of the blood vessel walls due to fatty deposits called plaques, which reduce blood flow to the kidneys, raise blood pressure, and damage the kidney's filtration system. The Journal of Multidisciplinary Healthcare published a small-scale study in 2022 that examined the effects of smoking on people who were otherwise healthy. The findings revealed that increased smoking was linked to higher creatinine levels. The good news is that quitting smoking may lower your creatinine levels. The longer you refrain from smoking, the lower your risk for further kidney damage. However, smoking can be a difficult habit to stop. Luckily, there are many tools out there to help you quit smoking. Ask your doctor for resources such as counseling, medications, or nicotine gum. Gather support from loved ones and pick a quit date. Be prepared for challenges. Changing habits like going to smoke-free places or spending time with friends who don't smoke may make quitting easier. You might need to find ways to cope with difficult emotions, like using relaxation methods, such as deep breathing and meditation. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 2. Get high-quality sleep. People with CKD commonly have sleep disturbances. Common reasons include uncomfortable nighttime leg twitching, called restless leg syndrome, mental health conditions, sleep apnea, and medication side effects. Additionally, people with severe CKD may have problems sleeping due to a buildup of toxins and chemical imbalances caused by poor kidney function. Patients undergoing regular dialysis may sleep during sessions, which causes an imbalanced sleep-wake cycle. Getting regular, high-quality sleep lasting between 6 and 8 hours can lower creatinine levels and prevent the progress of kidney damage. High-quality sleep is associated with fewer sleep disturbances, like difficulty falling asleep or staying asleep. While the mechanism is not fully understood, appropriate sleep reduces risk factors for kidney disease such as diabetes, obesity, and high blood pressure. It can also trigger the body's fight or flight response and inflammation, causing damage to the kidney's filtration system. Getting good quality sleep may also be preventive. A 2019 study in the Journal of Clinical Sleep Medicine found that over an 8-year period, people with sleep disturbances or poor quality of sleep, those who slept less than 4 hours, or those who took sleep aid medication, had an increased risk of developing chronic kidney disease. By focusing on sleep quality and quantity, people may be able to prevent worsening kidney damage. Early recognition of poor quality sleep is essential and should be addressed to prevent worsening kidney function. Treatments include taking medications to prevent or decrease restless legs, using cognitive behavioral therapy to help with falling or staying asleep, and removing enough fluid during dialysis to improve sleep apnea. 1. Eat more plants. Following a mostly plant-based diet will also help you improve your kidney function and lower your creatinine levels. These are safe for people with CKD and additionally improve GFR and delay the need for dialysis. Eating primarily plant-based foods also provides better management of unhealthy cholesterol, weight, blood sugar, and blood pressure levels. These benefits prevent or reduce kidney complications associated with cardiovascular disease, high blood pressure, and diabetes. The American Journal of Kidney Diseases published a study in 2023 that assessed the effects of following a plant-based diet over 5 years in people with different stages of CKD. In fact, the researchers found that people who consumed more meat and processed foods like white flour and rice, and sugary foods and drinks, had lower life expectancy and worse CKD outcomes. Consuming more plants and less meat and processed foods is beneficial for those with kidney disease, even more so when the disease is in its early stages. When you develop a habit of eating a whole food, plant-based diet, you eat mostly fruits, vegetables, and whole grains suitable for people with CKD. You'll also eat legumes, seeds, nuts, herbs, and spices. Lastly, you'll avoid or limit the consumption of meat, dairy, and processed food. Including more plants in your diet increases your antioxidant levels, which reduce kidney tissue damage, and phytates, which lower blood phosphorus levels. Phosphorus, usually found in dairy products, is harmful to the bones and blood vessels in people with CKD. Eating less meat reduces the amount of protein in the blood, which results in lower acid levels. When acid levels are too high, known as metabolic acidosis, the kidneys have to work harder to maintain the right acid-base balance. Metabolic acidosis leads to the kidney's filtration system damage, inflammation, muscle wasting, and bone breakdown. By avoiding processed foods, you can limit the harmful effects of high salt, sugar, unhealthy oil, and artificial food additives. In this section, we discussed key habit changes you can make to help lower your creatinine levels, exercising regularly and preventing overexertion, eating more fiber and a plant-rich diet, and limiting salt intake. Others include avoiding over-the-counter anti-inflammatories, improving sleep, and stopping smoking. Next, we will discuss when to see a specialist, additional testing that may be needed, and treatment options. Getting to the diagnosis. When muscle cells break down, a protein byproduct called creatinine circulates in the bloodstream. The kidneys eventually filter out creatinine from the blood, which then leaves the body through urine. Creatinine testing assesses kidney function by measuring levels in both urine and blood. Doctors monitor creatinine to identify kidney damage early or worsening of existing damage. Increasing levels may indicate a slowing kidney filtration rate, known as the glomerular filtration rate. There are many reasons for high creatinine levels. Some aren't the result of kidney damage. These may include muscle breakdown from high-intensity exercise or muscle wasting. Other potential causes include pregnancy, poor hydration, dietary protein in cooked meats, and bodybuilding supplements. Kidney-related factors leading to increased creatinine levels might be infections, certain medications or blockages caused by kidney stones, tumors or injuries that can obstruct urine flow. Health conditions, such as diabetes, elevated blood pressure, congestive heart failure, and excess weight, also increase your risk for kidney damage. If you have high creatinine levels, treating the underlying cause as soon as possible may stop or slow down kidney damage. You may need to see a nephrologist, a medical doctor specializing in kidney or kidney-related conditions. Involving a nephrologist in your care can also be helpful if you have conditions like high blood pressure or diabetes, which can cause kidney damage. After learning about your medical history and performing a physical exam, your nephrologist will order lab tests to help determine the cause of your high creatinine. These tests may include blood sampling to check your blood cell count, blood urea nitrogen, or BUN, GFR, or cystatin C. They will also want to check urine tests, such as a urinalysis, protein to creatinine ratio, albumin to creatinine ratio, or creatinine clearance. Sometimes, saliva sampling can be helpful for genetic testing to rule out any genetic link disorder that may impact your kidneys. Imaging studies help visualize the kidneys. These tests may include ultrasound, X-rays, computed tomography, or CT, and magnetic resonance imaging or MRI. Your doctor might request a biopsy in which they obtain a sample of kidney tissue to diagnose a suspected or unknown condition. Treatment. Once the cause of your high creatinine is determined, various treatment options may be available. For people with high blood pressure, diabetes, or heart failure, managing these conditions can help preserve kidney function. Lifestyle changes that may be beneficial include taking medications, such as antidepressants. For more information, visit www.fema.gov. Adding or excluding types of foods, improving sleep, lowering stress levels, exercising, and managing weight. Rates of CKD are steadily climbing and may be preventable with daily habit changes. According to a 2023 review published in Kidney Medicine, lifestyle changes may affect creatinine levels and directly or indirectly affect kidney health. Several conclusions from the meta-analysis were: exercise made the most significant impact on improving creatinine levels. Dietary interventions helped control blood pressure and reduce protein leakage into the urine. The combination of weight loss plus blood pressure management may positively impact kidney health. There was an overall improvement in quality of life. People who make positive changes may have better kidney health outcomes, although it remains unclear which lifestyle changes and their combinations lead to the best results. CKD is usually not reversible in later stages. Depending on the severity of CKD, some people may need long-term dialysis. A dialysis machine filters waste and excess fluid from the blood, replicating what your kidneys would normally do. This can be done at home through peritoneal dialysis, nightly or in a clinic a few times a week with hemodialysis. Patients on long-term dialysis might be considered for a kidney transplant. Monitoring your health status is essential. Treating health conditions related to kidney damage, such as high blood pressure, low red blood cells and diabetes, helps prevent complications in other parts of your body. You have learned several fundamental facts about creatinine and its relation to kidney function. Creatinine levels can be early indicators of kidney damage and are used to monitor the progression of kidney disease. Levels may rise when the kidneys can't filter the blood and remove waste properly. Factors linked to increasing creatinine include health conditions, such as high blood pressure, diabetes, and excess weight. It's never too late to start making small daily lifestyle changes to help lower high creatinine levels because they might significantly benefit your kidney function and overall health. While chronic kidney disease may not be reversible, implementing these 7 beneficial habits can prevent the worsening of your condition and improve your quality of life. We hope you enjoyed this video about 7 daily habits that can help lower your creatinine levels. Watch more of Health Today's content to learn about trending health topics. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Everything we've discussed in this video might be wasted if you don't watch the video on the screen. Here, we share the worst 22 foods that can ruin your effort to lower creatinine and prevent kidney disease. We also offer tips on how to still enjoy them or find great alternatives. See you there. Stay informed. Stay healthy. 10 foods for kidney health. There are few organs in the body that one can lose one and still live a relatively healthy life with only one of those organs. Spleen, lungs, and kidney are few of these organs. However, living with 2 unhealthy or damaged of any of those organs can shorten your life drastically. In today's video, we will share healthy kidney foods that you must eat to keep your kidney healthy and functioning correctly. The kidney function is essential to your overall health because it is responsible for controlling the body's fluids. It also functions as the body's primary way to filter the blood and remove waste. Without a properly functioning kidney, your body could become overwhelmed by toxins, which could lead to severe conditions, if not death, to support your renal health. The best thing you can do is switch to a diet that is low in sodium, phosphorus, and potassium. Ideally, you would consume no more than 2,000 milligrams per day of sodium and potassium, and limit your phosphorus intake to 1,000 milligrams per day. That is because these minerals burden the kidneys and could overwhelm them enough to affect their function. Here are the top 10 foods for kidney health. 1. Apples. Apples are incredibly good at supporting optimal kidney function because they are rich in anti-inflammatory compounds. They are also rich in pectin, a soluble fiber that helps manage risk factors for kidney disease, including diabetes and high cholesterol. Additionally, a medium-sized apple only contains 1.8 milligrams of sodium, 195 milligrams of potassium, and 20 milligrams of phosphorus. 2. Bell peppers. Bell peppers are rich in antioxidants that help repair damage in the body. They are also full of vitamins, minerals, and fiber, which are essential to your overall health. For those concerned about kidney health, this is an excellent vegetable to eat because a medium-sized pepper only contains 4.8 milligrams of sodium, 251 milligrams of potassium and 39 milligrams of phosphorus. 3 blueberries. In 2014, researchers from Louisiana State University led an animal study on the effects of blueberries on renal function. They found that a diet enriched with blueberries has profound protective effects on the kidneys, mainly because of its remarkable antioxidant and anti-inflammatory properties. Plus, blueberries are an excellent addition to a kidney-friendly diet, because 1 cup contains only 1.5 milligrams of sodium, 114 milligrams of potassium, and 17.8 milligrams of phosphorus. 4. Cabbage. Cruciferous vegetables, in general, are beneficial to the body. Cabbage is an excellent source of phytochemicals that support organ health. Apart from being packed with fiber, it is rich in folic acid, vitamin B6, vitamin C, and vitamin K, all of which contribute to optimum renal health. Plus, 1 cup of shredded cabbage only contains 12.6 milligrams of sodium, 119 milligrams of potassium, and 18.2 milligrams of phosphorus. 5. Cauliflower. Cauliflower offers the same benefits that all cruciferous vegetables do, but apart from the fiber, vitamins, minerals, and phytochemicals, it is also rich in beneficial compounds called thiocyanates, glucosinolate, and indoles. These compounds are useful in flushing out toxins in the body and consequently, minimizing the load on the kidneys. Besides, half a cup of boiled cauliflower contains only 9.3 milligrams of sodium, 88 milligrams of potassium, and 19.58 milligrams of phosphorus. 6. Cranberries. According to the National Kidney Foundation, cranberries are beneficial to kidney health because it contains compounds that prevent unwanted bacteria and ulcers from reproducing in the urinary tract. So, consuming cranberries in any form helps minimize the risk of UTIs and protects the kidneys. Also, a cup of unsweetened cranberry juice only contains 5.1 milligram of sodium, 195 milligrams of potassium, and 32.9 milligrams of phosphorus. 7. Egg whites. Proteins generally place a heavy burden on the kidneys. That is why renal patients are often made to avoid red meat. But egg whites are an excellent source of proteins that do not affect the kidneys the same way meats do. That is because the whites of a single egg can give you up to 4 grams of protein with only 2 milligrams of sodium, 53.8 milligrams of potassium, and 4.9 milligrams of phosphorus. 8. Garlic. Garlic has been a staple in natural and traditional medicine for centuries. It is most useful for its antibiotic and anti-inflammatory properties, which are essential to kidney health. A study published by the Journal of Nutritional Biochemistry specifically showed the antioxidant effects of garlic supplementation within the body. That proved to have positive impacts on various organ functions, including the liver and kidneys. Additionally, 3 cloves of raw garlic only contain 1.5 milligrams of sodium, 36.1 milligram of potassium, and 13.8 milligrams of phosphorus. 9. Onions. As part of the allium family, onions have plenty of health benefits. But for kidney health specifically, it is useful for its flavonoid content, which helps minimize cellular damage. It is also rich in chromium, which boosts the metabolism of proteins, fats, and carbohydrates, and consequently reduces the burden on the kidneys. Plus, a cup of sliced onions only contains 4.6 milligrams of sodium, 168 milligrams of potassium, and 33.3 milligrams of phosphorus. Raspberries. In 2011, researchers from the Jordan University of Science and Technology Orbit led an animal study on the effects of raspberries on the kidneys. They found that these berries have a prophylactic and therapeutic effect on kidney stones. But apart from having the impressive ability to eliminate kidney stones, it is also excellent for kidney health because 1 cup of fresh raspberries only contains 1.2 milligrams of sodium, 186 milligrams of potassium, and 35.7 milligrams of phosphorus. Thankfully, the best foods to take for optimum kidney health are easy to find, relatively inexpensive, and simple to incorporate into a healthy diet. Make sure you load up on these foods to give your kidneys the nutrition it needs to function correctly and to support your body for as long as possible. Following our study references, we used it in the creation of this video. Thank you for watching. And please subscribe to our channel if you haven't already done so. New subscribers, click on the bell icon when you subscribe. Old subscribers, please turn on all your notifications.